Thank you for that lovely introduction, Donna, and thanks to all of our generous donors for joining us tonight. As Donna spoke of, our vision for Arthur M. Blank Hospital is to build a cutting-edge, innovative hospital and campus, a place to provide unparalleled clinical care that serves the needs of kids today and those well into the future. To do this, we need the help of partners and the entire philanthropic community. We need all of you. Tonight, I'm joined by two of our campaign chairs, Allison Dukes and David Ratcliffe. We're going to talk about their involvement in Children's. Allison is a trustee of Children's Healthcare of Atlanta, and she's the Chief Financial Officer of Invesco. David is the retired Chairman, President, and Chief Executive Officer of the Southern Company. They're joining us tonight to share their passion about Children's Healthcare of Atlanta and what they see as the future of our system. Allison, tell us how you became involved at Children's.
Well, I first, became involved with Children's as a parent. I found myself in the emergency room at Eggleston at 2 o'clock in the morning with our firstborn, so 13 years ago. And there's, that will live in my memory for a long time. And it was a scary time. And I got to know CHOA immediately and how amazing it is and how Children's takes care of not just my children, but they took care of our whole family. And that's really what makes Children's so special. And then I had the privilege of joining the foundation board about probably 4 or 5 years ago. And then I joined the system board as a trustee about 3 years ago. And it's just a joy to serve Children's Healthcare. It really is.
We're so glad that you volunteer with us. I had a similar experience. My first visit to Children's was as a mom in an ambulance with my then infant daughter. And so I share that same first experience of knowing how Children's really sets itself apart and takes care of the whole family.
Truly.
And what about you, David? Do you have a special connection to the organization?
I do, Janine. It's kind of a funny story. About 30 years ago, I was in the slot as the CEO at Georgia Power Company here in Atlanta. And as you know, Children's does an annual Christmas parade. Well, a part of that parade at that time was what they call the Clown Parade, where they actually invited executives in Atlanta to dress up like clowns and participate in the parade and hand out candy during the parade. So a friend of mine was in it and asked me if I would do it. And I said, sure, sounds like it'd be fun. So I literally went over to Children's one morning, and we had a great opportunity to visit the children. We dressed up as clowns, literally, makeup and everything, big noses and costumes. And then we'd go visit the children and hand out some candy where we could. And then we'd go have a great time in the parade. So it was a great opportunity just to act totally silly and nobody to know who you were. And so I had a great time doing that for several years. And then another friend of mine, Doug Hertz, who's been very active at Children's over many, many years, asked me if I would consider joining the board, and that was an easy yes because of the reputation of the organization and the involvement there for a couple of terms, and then as part of this campaign has been significant for me.
Well, I'm so glad you're involved, and I didn't know about the clown parade, so I learned something.
Well, one of my great friends took a picture and sent me an email and said, "Can you believe a clown is running Georgia Power Company?"
Perfect. So some of the things that do set Children's apart from other pediatric healthcare providers include our donor-funded programs like the Child Life Specialists, the chaplains, our facility dogs, music therapy, family libraries, the play areas, and hospital-based classrooms. And all of these are important components for the care and healing of kids and their families. How important is it to support these programs at Children's?
It's incredibly important. It's really what makes Children's so unique and so special. It's really about how Children's improves the care journey for patients. For instance, Children's now has incredibly detailed and customized surgical plans that help accommodate the needs of every child as they prepare to go back for surgery. And while that's really beneficial to all of our patients, it really is especially important to our children that are on the autism spectrum and who might have some sensitivities to certain sounds, to textures, to different lighting. A lot of our patients also reference the facility dogs when they talk about their stays at Children's, and that really being a favorite part of being in the hospital. If there can be a favorite part of being in the hospital, it's about our dogs. And the facility dogs help motivate our patients to get out of bed, to participate in their physical therapy, to provide a reason to maybe go visit the library, to grab a book, to keep up with their schoolwork.
It's true. I love the therapy dogs as well. David, it's so exciting to see the construction crew hard at work to make Arthur M. Blank Hospital come to life. The hospital will feature 116 additional beds and larger rooms to make life easier for patients. David, what about the new hospital excites you the most?
It's kind of hard to say when you say most. There's so much about it that excites me. But fundamentally, what excites me is the opportunity to do significantly more than what we've been doing because of the new facilities, the new space. You mentioned an additional 100 plus beds. We'll have 115,000 new square feet for the Heart Center to do its work. That's huge. That's an opportunity. When you look at the design of the space in the hospital itself, plus the campus, the work that has gone on to create a truly unique experience for patients first, and their families, and of course to make it easier to do the work that the docs do day in and day out. That's what excites me. The green space that's part of that campus, 20 acres of green space, that's a huge new addition. That's going to be a magnificent facility, a magnificent campus. It's easy to get excited about what I see.
It's true. We're all very excited for what's to come. Allison, Arthur Blank has made such an incredible impact on our community. How do you see Arthur M. Blank Hospital having an impact on our city, state, maybe even our country?
Yeah, it's really incredible, and we're so grateful to Arthur Blank for such an impactful, transformational gift. The hospital and the surrounding campus will serve as a beacon of hope and a magnet for talent. And it really further underscores our reputation as a destination for those that are really committed to pediatric care and to attract top physicians to our state. It really will differentiate our entire state. At the Arthur Blank Hospital, Children's will continue to partner with Emory and the University School of Medicine, with the Morehouse School of Medicine, with Georgia Tech, and really helps us serve as a national and global leader in taking on pediatric care and our greatest challenges in pediatric care. The Arthur M. Blank Hospital provides Children's with the ability to care for even more patients than ever before, and it allows us to continue to remain a level 1 dedicated pediatric trauma center, which is so important to the state and the development of our state. And with the innovations of this new hospital, Children's is going to be able to help and heal thousands more children that are in need of emergency care.
David, the expert care provided by our 4 centers is consistently recognized on a national scale, with the Aflac Cancer and Blood Disorders Center, the Orthopedics and Sports Medicine Center, and the Brain Health Center, all ranked in the top 20 for their individual specialties for 2020 in U.S. News and World Report's Best Children's Hospital list. How do you see Arthur M. Blank Hospital enhancing our national reputation?
Well, Janina, you rattled off several centers that are part of the hospital activity that goes on day in and day out. And those centers have achieved significant acclaim in and of themselves, and as you said, have been ranked nationally. So this hospital will simply allow us to do all of that at a higher level of expertise with greater classification of research around that. So we'll be able to contribute more than we were before. When you think about what goes on in the Aflac Blood Center and the work that's done there with sickle cell disease and gene therapy and the work that has been done there, that's leading edge, cutting delivery of medical capability to people who need it desperately. That's going to be significant. I think the opportunity to do more research in the Aflac Cancer Center, the Heart Center, the orthopedic work that gets done. We already do more orthopedic surgeries, I think, than any other hospital in the state as it relates to pediatric care. So I think just the opportunity to do significantly more at a higher level of expertise will simply raise the reputational value of Children's across the entire country.
Yes, I think that's right, and it also gives us all so much hope for the future.
Yeah.
Our patients at the Aflac Cancer and Blood Disorders Center embody a type of strength that is inspiring, especially considering the tough year our community and nation have faced. One patient we'll meet later in the program is 16-year-old Makari Tarpley. Makari was diagnosed with cancer in the spring of 2020 and she's unable to have that sweet 16 birthday party that she'd always dreamed of. She and her family were inspired to give back. While Makari was undergoing chemotherapy treatments, one of her young neighbors was recovering from a bone marrow transplant at Eggleston to treat his sickle cell disease. Makari decided to start a fundraiser with the goal of raising $16,000 for Children's Sickle Cell Disease Program. Thanks to generous friends, family, and neighbors, Makari met her goal. Talk about inspiration. Allison, who is your inspiration and source of strength during this time?
Well, without question, I find everybody at Children's to be an inspiration. As I, think about the doctors and nurses and all of our clinicians, those that are serving our children through the last year, it's really incredible. And I have to say, just the opportunity to work not just with the clinical staff, but really the executive team. I mean, Donna Highland and all of you on the executive team, the way you run this organization and the way you are leading the effort to build the new hospital and the impact it will have on our state, I find it incredibly inspiring.
This pandemic has shown us we have so many things to be thankful for in spite of the challenges. Since we can't share our gratitude in person, what would each of you say to those who are generous enough to donate to Children's tonight?
First of all, thank you. Thank you for being a part of this tonight. I wish we could all be together in person. You are participating in something big, and something that's bigger than us. I really, truly believe that what we are doing in building this new hospital is transformational, and it will provide not just my children access to incredible health care, because they may be too old for the new hospital by the time it's finished, but my grandchildren and their children. This really is protecting generational access to health care in the state of Georgia, and I'm incredibly grateful to everyone who is coming along in this journey with us.
Well, I certainly agree with Allison about a great big thanks to everybody who's participating in this event as well as in the campaign itself. I don't think there's a higher calling in society than trying to help sick kids and kids who need significant help when it comes to the illnesses that they face. So the opportunity for us all to participate is something we ought to feel really good about. So I hope that everybody who's involved will dig deep. I hope they will contribute. I hope they will feel good about it, because the work that's being done is transformative. I think the hospital and the entire campaign is an opportunity for us to be a part of something that is generational and transformational. So I'm excited about that.
I love that. Allison and David, thank you so much for sharing your insight with us and for sharing your leadership with Children's. It was my honor speaking with both of you tonight. And to all our donors who are tuning in, thank you. None of what we are talking about would be possible without you.